There's a number of steps to PHReD-T. Could you give us some insight and information as to how to complete those steps and what they are?
Sure. So there's 5 main steps. Step 1 is really about understanding the workplace and developing your scenario. Step 2 moves to identifying the hazards in that scenario. Step 3 is about brainstorming your redesign strategies. Step 4 then moves to planning that work design, so getting more specific on the work redesign. And then step 5 is about building the case for implementation and doing some consultation on what you've designed.
To break it down a little bit more, let's start with step 1. Can you give us some example and some insight into, if you're using the tool, what should your scenario entail, or what should step 1 entail when you're filling it out?
Well, step 1 is really important because it goes from a really broad, general level to get us really specific to the specific scenario that we're going to use. And we use one specific scenario throughout the rest of the tool. We start very broad with a description of the workplace and understanding the context of the workplace. And that aligns with basic risk management frameworks and practices, that in order to manage any kind of risks, we've got to understand the context first. So that's why that context part is there. It seems a bit strange sometimes to be asked to fill in a tool with really broad information about your workplace, like how many people are there and who are they and what's the gender mix and what's the skill mix and what's the objectives and what is the organisation there for, who is it serving. But it's actually really important to have that context for proper risk management. So that's why that's there. So then moving from that broad understanding of the workplace context, and for hospitals that'll be about saying what health district are you in, what's the community like that health district is serving, what's the workforce like, what are the demographics, what are the components of the workforce. Moving from there to a more specific scenario. Now, you could choose for that scenario to be at a particular site or a particular work group at a particular site. So it really depends on what you're wanting to focus on. But that's also another reason to try and define what you're doing in the scope of your scenario. So the tool helps you to identify a range of scenarios and then pick one that you're going to focus on. And then after you've chosen the scenario that you're going to focus on through the rest of the tool, in step 1, we analyse that scenario in a little bit more detail. It's kind of like a modified task analysis. It really gets you to pull apart all the elements of that scenario. So things like who's doing the work in the scenario, what are the skills of the people doing the work, how many people are doing the work, when is the work being done, what are the tasks that they're doing, where are they doing it, what's the physical environment like, and what are the processes or systems that might be having an influence on the work that they're doing and how that work needs to be done. What are the resources and equipment that they're using? So a kind of a modified task analysis to help us really drill down into the scenario. And you might start noticing at that point a couple of things. You might start noticing where some of the hazards might arise from, and you might also start noticing some of the opportunities for redesign. That's why step 1's really important, because it helps you in the later steps. So then in step 2, we follow up with identifying the hazards.
Can you unpack step 2 for us a little bit?
Sure. So step 2 was really just about identifying the psychosocial hazards and risks that are present in that scenario. Not in the whole organisation, not in the whole context, but specific to that scenario. Okay? And so you might be assisted there by what you already know about the scenario, the data you already have, reports you've had, trend data, observation. There's a whole bunch of ways in which you can identify psych hazards and risks, and some of the resource material for PHReD-T talks about the ways in which you might identify those hazards. And then, so in step 2, it leads you through a list, really, of potential psych hazards based on the code of practice. And it also gives you opportunity to talk about other hazards. I think it's important to note that you should be expecting that there's likely more than one psych hazard in any scenario. All psych hazards can co-occur with one another. They can influence one another. That's one of the points in the regulation and in the code. They interact. And they don't just interact with each other, they interact with all other hazards. So you should be expecting to be having conversations about all the types of hazards that are present in this scenario. That reflects that systems thinking, how we need to think about this as a whole system. And it's part of the reason why we use a scenario-based approach, because it naturally helps people to think about everything that's going on. Not just thinking about one hazard by itself, but to think about that hazard and how it might play with everything else that's going on. So step 2 is really about identifying the hazards and understanding what impact they might have.
Excellent. And step 3, I understand that it focuses on the work redesign element to effectively control those hazards. Can you tell us a bit more about that?
Yeah, so step 3 is about starting that conversation or brainstorming around how might we redesign the work based on the hazards that we've identified. And that's where we introduce the work redesign model. So there's a model in the tool. It looks a bit like a lotus flower where the petals are all overlapping. And it gives you a bit of a guide to the kinds of things that you might consider when you're brainstorming redesigns. So it's got processes and systems, equipment and resources, people, tasks, and the physical environment. And it's drawn to reflect how, all of those overlap with one another. And it's not necessarily the case that we have to have a redesign strategy under each of those petals of that model. And it's also not the case that it's necessarily clear how it's one and not the other, because they overlap. But it's a bit of a guide to help us think broadly about all the possible things that we could do, rather than just focusing on one thing, but to think about all the possible small but meaningful changes that we could make.
A holistic approach to psychosocial hazards and controls, which is great. And then that leads us on to step 4.
Yeah, so step 4 goes a little more in detail to actually take some of those designs that we've brainstormed, and hopefully we've got a whole lot of them, a big list, to take some of those and then prioritise them a little bit. So which are the ones that we're going to focus on for now? Doesn't mean that we'll forget all of them from step 3, just means that for the purposes of the tool and for moving through this activity, which is intended to increase our skills and confidence, remember, that we will then prioritise some and work on them a bit further. So we prioritise some redesigns and start developing a bit of a plan for how and why that redesign strategy might work. So one of the unique parts of step 4 is that we ask people to develop change logic for their redesign strategy. Change logic is a bit of a fancy term for just articulating how and why that proposed redesign is going to work. How is it going to address the hazard that it intends to address? It's a unique feature of PHReD-T, and it's a real advantage, I think, because it helps people to think a little bit more deeply about what they're doing and why they're doing it. It also helps to build the case for implementation, because as opposed to just suggesting a redesign, here we're suggesting a redesign and we're able to say how and why it might work. And so step 4 also has a section that asks you about how you're going to evaluate your work redesign. Because we all know we need to evaluate things, but we often don't do that at the start. We often do that at the end. So what this tool does is get people into the practice of designing evaluation at the front, at the start. There's lots of ways to do that. It doesn't just have to be feedback from staff. It doesn't just have to be surveys. There's lots of creative ways of using the data that you've already got in your organisation. There's loads of data in most organisations that you can use that can help you with that evaluation. So the evaluation part in step 4 asks you not just to say how you're going to evaluate, but when. You could use some of the material that you might have needed to collect in order to do steps 1 and 2 to help identify your focal scenario, to know what data you might have available to you to do evaluation later.
And then that brings us to step 5.
So step 5 is a bit of a wrap up and follow on to get you really ready for implementation. So we know that when you develop a proposed redesign, which is a proposed change to how work is done, you need to consult. So step 5 helps you to consolidate your plan and put it in a format that you could then plan how you're going to consult on. So it asks you who you're going to consult with, how you're going to consult, and gives you a little space to actually go and do that and feed that consultation back in to your plan before you then make a summary of the plan, how it's changed with consultation, and what you're actually recommending for implementation. Now, it's not always the case that you are completing PHReD-T for implementation. Sometimes you're using PHReD-T as an exercise to build skills, to demonstrate a process, and to start to embed some of the aspects and elements of PHReD-T into your regular practice. So it's not always the case that you're necessarily going to go through to implementation. Of course, we encourage people to do that. It's great if you can get strategies for implementation, but you can stop at step 5 or pause and wait for when the right time for implementation might be. So you don't need to be afraid that doing this means you're going to have to implement it in the next 2 weeks.
Yeah, I think that's alleviated a lot of fears, because if you're going through this process and then it's, in the case of a New South Wales hospital, it might be the middle of winter, and then you're extremely busy and you've got lots of patients to deal with. So you might pause that, deal with the work environment, and then come back to it when everything's sort of settled after the winter season.
And so in lots of larger organisations, if teams are working through this, you might have teams working on each other's scenarios. You might have the same scenarios distributed to a range of different teams. They might all work on it separately. You might collate those redesigns together and have a process to see what are the commonalities of the redesigns that they've developed. And so you might end up in a large organisation with a cache of potential redesigns for known problems in your business that you can then reprioritise for implementation and take forward. So there's lots of different ways of feeding this into the structures and frameworks that are already within your business.
Yeah, it sounds excellent. After completing the 5 steps, you will now have your action plan, including evaluation plan, ready to implement. The tool finishes by providing a few final steps for you to consider.